surgery becomes an option or a necessity, we do have a lot of choices now. Fortunately, medical science has made a lot of advances in the last several years, so that when women are faced with having surgery, it's not a dramatic, life-altering experience, generally, as far as their activities go. Of course, there are decisions to be made about choices, whatever the medical problem has to be, that may affect those life choices in the future. But as far as work and family activities, we have come a long way to keep women from having to stay in the hospital for a long time when they have to have surgery. For instance, a woman who is faced with having to have hysterectomy comes in, and generally comes in the day of her surgery and has 1, 2, or 3 very small incisions in our abdomen, sometimes 4, that lets us use a laparoscope to begin the hysterectomy process. We're able to conserve or prevent her from losing her ovaries in many cases, and a lot of times she's able to go home the next day. I've had patients even go home that day if they did extremely well. And of course, there's still some limitations afterwards, such as not being able to lift heavy objects for 4 to 6 weeks. Sexual activity has to be curtailed for 4 to 6 weeks, but many times if they're able to have a successful laparoscopic hysterectomy, our patients can go back to work within a couple of weeks, depending on what kind of jobs they do, of course. We also have, I mentioned an endometrial ablation, which is something that we do try to use whenever possible to prevent women from having hysterectomies if they are faced with having severely abnormal menstrual cycles. That is actually an outpatient procedure. We're able to go in through the vagina without having to make an incision at all and treat the lining of the uterus with various techniques that prevent the uterus from actually building up to have a period every month. So in greater than 90% of the case, most patients either quit having a menstrual cycle or go back to a very minimal, average, normal cycle that they're very pleased with. It doesn't always work out that way, but it does in the vast majority of cases. So if the patient is a good candidate for an endometrial ablation, we usually advise that rather than actually having to have a hysterectomy.